You're listening to the Doctor Is In podcast, brought to you by MartinClinic.com. During the episode, the doctors share a lot of information. As awesome as the info may be, it is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes.
Well, good morning. I want to do a little talk this morning on insulin resistance. Now, you guys know us at the clinic. Well, we wrote a book several years ago talking about two hormones that want you dead, serial killers, two hormones that want you dead. And one of them, if you remember, is insulin. Now, insulin is every time you eat, you need insulin. And one of the causes, and we believe this very strongly, we live in a different world today. People are carboholics. They consume, the average North American is consuming, without even knowing it, approximately 200 pounds of sugar a year. Like, it's craziness. When I was a kid in the 1950s, a long time ago, Canadians and North Americans were consuming 25 pounds of sugar a year. It's 200 pounds. So we live in a different world, and I want to talk to you this morning about the cause of a lot of, it's certainly at the root of many diseases, but I want to just talk to you this morning about insulin resistance. So what is that? Well, if you overuse insulin, now remember, you need insulin every time you eat, except if you eat fat, okay? So Eskimos don't get heart disease. They don't know what that is, okay? Because they're eating fat all day long. They don't use their pancreas very much because they're eating fish and seal and organ meat and blubber and fat. They don't use insulin. Eskimos die because the polar bears eat them. Not because of, they don't get our diseases. Like, they don't get diabetes, and they don't get cancer, and they don't get cardiovascular disease because, even though they're eating a lot of fat. So every time you have a carbohydrate, especially, okay, so your bread, pasta, rice, cereal, sugar, sweets, pastries, muffins, bagels, man-made yogurt, and milk, because milk is really white Pepsi, I call it, today. And when you're having that, you are consuming an enormous amount of sugar. And your pancreas goes crazy because it secretes insulin. Insulin's primary job is to take sugar out of your bloodstream. You know, your body will do everything it can so that you don't become a diabetic. You have a protective mechanism that is so unbelievable. It's out. Insulin gets sugar out of the bloodstream. Why is that? Because sugar is so toxic. You can't have sugar in your bloodstream. Sugar in, like a little teaspoon in 5 liters of blood is all, you don't even need that. That's too much. And so your body does everything with insulin. Insulin is a storage hormone. So once it gets sugar, it has to take it out of the bloodstream and store it in 3 places, either in your liver. That's why, and we'll talk about that in a second, and in your muscles, and it'll make fat cells. Do you know that your body has the ability to make as many fat cells as it needs? Why do you have fat cells? So that insulin can store sugar there. Yeah. So carbohydrates, sugars, are stored in your liver, your muscles. That's why it's good to get strong muscles. And this is why we talk about getting your body strong, especially with weight or resistant exercises. It's just because this is so good for you, because it allows you to have more storage for your sugars. So insulin resistance is when, you know what, your body is so overwhelmed by insulin. You've used it too much. You're a carboholic. And, oh, doc, I'm not a diabetic. Diabetes is the last thing that happens. people don't realize that your body gives you clues, warning signals. Wouldn't it be nice if we had sort of a flashing light on top of our head saying, you know what? You got too much insulin resistance. This is not good, because insulin resistance, high circulating insulin, is one of the most detrimental things to your health. And it's the thing you can control, because you can control what you eat. Insulin is only secreted when you eat. This is why even this morning, you know what I did this morning? Intermittent fasting. Yeah, I'm not eating this morning. I had my coffee. Hallelujah. Because if I can't have coffee, I quit. I mean that. But I'm giving my pancreas a rest this morning. I'm actually giving my gallbladder a rest too, and giving my liver a rest, because it's not storing this morning, because I didn't use any insulin. So we're talking about insulin and insulin resistance. And when you use insulin over a long period of time, too much of it, your cells actually resist it. They don't want it anymore. Okay, like, don't give me any insulin. Like, I've had it. Stop. And I want to give you some clues that this is happening to you. Okay, here's some clues. One is fatigue. Now, fatigue can be a lot of things, right? But you must eliminate that your fatigue. If you're not like me, I'm a big baby when I'm not 10 out of 10. I get out of bed in the morning, get me 5 minutes. I have my water before I do anything else. And, I went for a walk early this morning. I feel great. I'm very thankful for that. Okay. But if you're not up to snuff, if your energy is not at a high level, then you ought to look and see if you're not starting insulin resistance. Okay. Like, if you ain't 10 out of 10 or 9 out of 10 or 8 out of 10, just make sure. Now, I mean, there's other things that can happen. You can have adrenal. We talked about that this week, adrenal fatigue. You can have thyroid. You can have estrogen too high, and that can affect your energy. I understand all that. But one of them, look at insulin. That's the one you can control. It's the one you can control, because if you cut your carbs down, cut those crappy carbohydrates out of your diet or get them right down. Big thing. Number one. Number two, acid reflux. It's sort of a hidden sign that you have insulin resistance. Isn't that incredible? Millions and millions and millions of people have acid reflux, and they take Tums. Or they, you know what I mean? Like, eat what, I love those commercials on TV, eat whatever you feel like and just tum to the tum-tums, and that'll be all right. But your body is screaming at you. You got acid reflux. Your body is telling you, hello, your insulin's too high. You're using too much insulin. And I don't care what your blood sugars are. Oh, my blood sugars are still normal. Oh, yeah? Well, your body is already pre-diabetic. If you have acid reflux, it's one of the most common signs of insulin resistance. Here's another one. Acid reflux, fatigue, and the third one, high blood pressure. High blood pressure. Guys, listen, like, it's probably like an epidemic today. People have high blood pressure. And when I'm getting older, I'm getting high blood pressure. That's not normal. It's never normal to have high blood pressure. It's a sign, almost invariably, that you have insulin resistance. You're eating too many carbohydrates. I talked to a lady yesterday that she said, I got acid reflux. And I said, well, listen, you're eating too many carbs. Oh, doc, I don't think I eat too many carbs. I said, what do you have in the morning? Cereal. Well, you're eating too many carbs right out of the gate. You eat cereal. Cereal is high carbohydrate food. Oh, doc, if I don't have my all bran, if I don't have my oatmeal, yeah, but you know what? We live in a different world today. There's so much insulin, and those are carbs, and you're turning to sugar, and your insulin You're eating about 40 grams of carbs in a small bowl of cereal. Oh, doc, I like my yogurt. Yeah, well, read the label. Look at how many sugars that are at, unless you make your own yogurt or you're eating Greek plain yogurt. I know, doc, but that don't taste good. I know. But otherwise, it's a high-carb food. And it makes you secrete an enormous amount. I drink my milk, doc. I need my calcium, my milk. And, it's 2%. Well, that's the size of your brain if you're drinking milk. It's white Pepsi. Quit drinking milk. Milk isn't milk. That's not what comes out of a cow. Skim milk, it doesn't come out of a cow. It's cream that comes out of a cow. So if you have a cow in the backyard, drink milk. Otherwise, forget it. Stop it. It's going to make you secrete an enormous amount of insulin. So fatigue, acid reflux, high blood pressure. And listen, when I say high blood pressure, if your second number is anywhere, so 120/80 in that area is, what they call normal blood pressure. Okay. But if your second number is creeping up to 90, it's getting close to that, you have insulin resistance. Your body doesn't like insulin anymore. Change your diet. It's the thing you can control. Okay, another symptom, kidneys, kidney stones. It's like an epidemic today, kidneys. And kidneys, I always tell people, listen, if your kidneys are not working like they should, you are a pre-diabetic. I don't care what your blood sugars are. Blood sugars is not the cause of diabetes. It's a symptom of diabetes. Insulin resistance is the cause of diabetes, and it is a big factor in cancer, and it is a big factor in heart disease, not cholesterol. I've never seen in my lifetime something that was so, you got to give Big Pharma a huge high five. I mean, they did a marketing job on the whole world. Doctors and dietitians, and cholesterol is the boogeyman. No, it's not. You can't live without cholesterol. Someone calls you fathead, take it as a compliment. Your brain is made up of fat. You need fat. You need more cholesterol, not less. You need good cholesterol. And God don't trust you to eat enough cholesterol. Did you know that? You can have 100 eggs and still 85% of your cholesterol comes out of your liver. So cholesterol is never the cause of heart disease. It isn't. Get that out of your brain. It doesn't cause heart disease. Cholesterol is normal. You need it. It's FedEx trucks on the highways delivering your hormones. It makes up every cell in your body. You need cholesterol. Every cell in your body is made up of cholesterol. Your brain is made up of cholesterol. If you have one, I know, I'm bad. I go on these rants, but I can't help myself because I can't stand lies. I can't stand lies. They're lies. Cholesterol never caused a heart attack in its life. It's insulin. One of the biggest things, because if you have insulin resistance, you have inflammation. You don't even know it. I'm not even talking about joint pain, although you might have joint pain. Okay? You might have joint pain. You might have pain all over. Your insulin's too high. Get your insulin down. It's why at the Martin Clinic, we always talk, always about a low-carb diet. Like you say, Doc, don't you get tired of talking low-carb? No. Why? Because it's true. It's true. Fat don't make you fat. Carbs make you fat. Sugars make you fat. Because of insulin. Insulin has to take that sugar out of your bloodstream and store it. Okay, so kidneys, high triglycerides. We talked about that. Remember, your liver is a suitcase. Your liver is a suitcase. It needs place for storage. You know, I was laughing because when we came down to Florida on the plane, you know, they're always trying to check your baggage to make more money, right? And I got a little thing. And some people, I get such a kick out of them because they sneak onto the plane with a suitcase and they can't get it up. they can't get it in the overhead compartments. They try and squish it every which way to get them in that overhead compartment in a plane to save themselves some money. I don't blame them. But you know what? That's what your liver is like. Your liver is storage. That's how you get fatty liver. Here's dangerous: high triglycerides. Not cholesterol, triglycerides, blood fats. You never hear about that. Why don't you hear about it? Because there's no drug for triglycerides. There's no medication for triglycerides. It's food. Cut your carbs down and your triglycerides go down. It's as simple as that. Yeah, you empty the suitcase. Your liver's a suitcase. Okay, couple of other things and I'll leave it there. Just women, you're the one. I'm speaking to you, but let me give you a couple of things to look out for on your hubbies, okay? If they have an inflamed prostate, they got to get up and pee. Insulin is the biggest driver of that. Estrogen too. But insulin, erectile dysfunction. Yeah, men don't want to talk about it. Ladies, it's caused by insulin. It's not caused by, you got a lack of Viagra. Viagra is, you don't have it. So that's what's causing your ED, erectile dysfunction. No, it isn't. It's insulin. It's insulin. That's what causes ED. And because insulin is inflammatory hormone when it's overused and insulin resistant. So there you go, guys. Very, very important to don't be carbaholics. I'm not saying no carbs. Come on. I'm not like that. I'm not going to tell somebody, Rosie's Italian. If I can't have any pasta, I quit. But I don't live on it. I don't. I got to be very careful. We have diabetes coming out both our ears in our family. So I have to be very careful of insulin resistance. I try and practice what I preach. Okay, guys, love you. You have any comments? You have any questions? I'll try and answer all your questions. You have any any topics that you want me to cover on these little teachings, let me know. Okay? Love you.
You've reached the end of another Doctor is In podcast with your hosts, Dr. Martin Jr. and Sr. Be sure to catch our next episode, and thanks for listening.